We have over 60 poster presentations, oral presentations. We're very excited about our data. Our glycemic variability study that we've done with Bydureon. And within that study, what we've shown is that there is a continuous glucose control over a 24-hour period. We see a significant reduction in the postprandial excursions, fewer hypoglycemic episodes. We're seeing some very nice results in terms of patients over 24 hours staying in that euglycemic range. So we're very excited about that data, and we're the first GLP-1 to use a CGM study and to show that that 24-hour glucose control. So we're very pleased with that data. What it does is it makes physicians aware of the fact that this drug will work. Bydureon works over a 24-hour period of time, and you're not seeing a lot of the postprandial excursions. You're not seeing these peaks of hyperglycemia, and you're not seeing an increase in hypoglycemia. So patients are pretty well controlled over a 24-hour period of time. Well, I think what it is for us in using the continuous glucose monitoring device methodology is that it just reinforces the confidence in Bydureon and the medication, showing that it does have a good control over a 24-hour period of time, and you're not seeing a lot of fluctuations, intraday fluctuations. So you can have a patient who is, quote, controlled in terms of their HbA1c, but they'll have a lot of intraday variability in terms of their glucose control. And what we're seeing with this study, with the CGM study, is it's quite nice. They stay flat and they stay in that euglycemic range. What we're doing again with Bydureon is we're very interested in the combination of a GLP-1 and a SGLT2, so we have Farxiga. So we are now studying those two in combination, and we're looking forward to seeing those results. Well, I think the biggest thing for AZ in terms of diabetes care is not just treating A1C, it's about treating the whole patient. So we have a number of compounds in early development. So we have a GLP-1 glucagon dual agonist, and that's looking at not only just control but also metabolic factors such as weight. We also have a GLP-1 PCSK9 compound in development, whereas that would be looking at not only glycemic control but control of lipids, cholesterol. So it's really, again, taking the approach of the whole patient. So metabolic disease, not just managing blood sugars. Well, it's in phase 2, so it's just going into phase 2. There's some data here that's being presented, very early preclinical data as well as some phase 1 data. The PCSK9 works on the cholesterol. The GLP-1 works on the blood glucose. So in combination, again, many patients with diabetes have comorbidities, right? They have heart disease, elevated cholesterol, elevated blood pressure. And so with this combination, we see that we're, again, trying to treat the whole patient in terms of their metabolic disorders. We also have 2 very exciting abstracts with Farxiga. The first one is looking at patients with renal impairment, various cohorts, and what we're seeing with an SGLT2, it's very dependent in terms of its ability to lower blood glucose. It's dependent on renal function. But what we're seeing in patients with lower renal function, we still have benefits on weight. We still see weight reduction, and we also see blood pressure reduction. So that's very exciting in terms of the data with an SGLT2, that you still have these other added benefits even though you're having less effect on blood glucose. The other thing that was very interesting work that we have done with Farxiga is a number of patients, as we mentioned, treating the whole patient is very important. So a patient with diabetes may have heart failure, they may have high blood pressure. So many of these patients could be on potassium-sparing diuretics. And as you may be aware, there has been some concern with an SGLT2 with hyperkalemia. So for us, it was very important to see if there was any hyperkalemia or elevated potassium in the studies that we have done. So we've done a pooled analysis looking at those patients on potassium-sparing diuretics, and we have not seen any increases in potassium. So that's really good for us because, again, it's treating the whole patient, right? So these patients are on multiple medications, and we want to make sure that with an SGLT2, the benefits it has, it's not causing other problems for the patient.